This is the first ever Medical Alley visit to Washington, D.C. We've had a long history of relationships with the state of Minnesota, and we've been able to leverage those relationships in the past at the federal level. But it's just been in the last 2 years, and COVID kind of got in the way of that we made a conscious effort to plant a flag out in Washington, D.C. And the thing that's been driving that is the fact that we are now representing a global epicenter and ecosystem across the industry, with our members having touch around the globe, looking for things to be solved at national and international levels, and therefore looking for relationships and the opportunity to have conversation and therefore impact with their Congress and senators, not just on the home front, but also in the states where they have physical presence with sales reps, manufacturing, and other employees.
Well, we are so proud of life-saving devices that come out of Minnesota. We have given the world everything in our state, from the pacemaker to the Post-it note. And a lot of that has to do with the hardworking employees we have in our state and the innovation and the technology. And we had a great meeting today. We talked a lot about workforce shortages, which is something we're seeing throughout our state. And to me, the answer there is getting kids connected with the degrees that are going to give them the good salaries and the jobs that we need. And it is also immigration reform, from visa caps to making sure that we pass comprehensive immigration reform. So in addition to some of the in-the-weeds issues, we talked a lot about workforce.
Well, what I was really impressed with is the commitment on the part of the legislators. I mean, they all came, they were on time, which was amazing to me given everything that's going on right now. And they spent the full time here, and they really leaned in. It wasn't like a flyby. It was really, they were interested in what we had to say. I think it speaks to our membership. When you look at the membership of Medical Alley, they get a one-stop with, providers, payers, manufacturers, therapeutics, devices, investors, IT, you name it. They're able to see the full spectrum of healthcare. So I think it's really important to them. It's helpful to them, but it's also helpful to us, both to get our kind of thoughts and issues out, but then to hear it from them.
I always say Minnesota takes a backseat to no one, and we have the ability to do so much. And with the experts in the room that I met today and I've met in the past, we have, the healthcare and the medical instrument manufacturing. It is such a crucial piece for the health of the American people and the world.
I think one of the things that strikes me is, from what we see every night, we see a lot of deadlock. We see a lot of an inability to work across the aisle, and we didn't really see that from most of our speakers. We saw a real openness, a true interest in healthcare, a true interest in being innovative, and not only to support our member companies and the sort of innovation that they need to do every day and demonstrate that they can do, but being innovative about the entire health system in the United States. And I think when we've got leadership on the federal level like this, I think that bodes well. So I'm taking a lot away from this.
Yeah, I think it's really important to be here to represent the industry as a whole, largely because there's a lot of policy decisions, a lot of activity in Washington that impacts our providers, our businesses, ourselves, our patients every day. And this is an important opportunity for us to be able to talk to representatives and senators who cover the entire country and have an impact on how they may view different legislation and policy decisions they're making.
As we look to go further in this effort, this is a busy time. It's a consequential time in our nation's history. It's a consequential time in how we address healthcare and the needs of healthcare. We talked a lot about health disparities. We talked about the importance of telehealth. We talked about the importance of being more competitive in a global market. All of these items impact your employees, your organizations, and the collaborative that we have at Medical Alley Association. So, being engaged is a key part of that. And we look forward to continuing the honor and privilege of representing you and your organization in Washington, D.C.